Hello everyone, today we'll be doing our presentation on telemedicine and accessing health services online. So in this presentation, we will cover what telemedicine is, the different options we have, and how to access it. So what is telemedicine? Telemedicine is a website/application that allows you to access medical services remotely. The American Academy of Family Physicians defines telemedicine as the practice of medicine using technology to deliver care at a distance. In short, telemedicine lets you see medical care professionals remotely via your devices. That can be your phone, tablet, or computer. You can see general physicians, nurses, dermatologists, therapists, and psychiatrists all through a website or an app. Here are some pros of telemedicine. It's more convenient and accessible patient care. It minimizes unnecessary non-urgent ER visits. It significantly reduces healthcare service costs, and it improves access to care, increasing patient access to specialists in rural or remote areas. It provides ongoing support to patients and family members. It increases the chance of continued independent or community home living. So here are some cons of telemedicine. It reduced care continuity. Patient's primary care provider may not have access to records from other visits. It's not suitable for all cases, and it's not offered by all doctors. Physical examination is limited because you are online, and it requires patients to learn to use telemedicine websites and applications. So when should you consider using telemedicine? Many less severe symptoms can be adequately assessed through a telemedicine visit, as can follow-up assessments for ongoing health concerns. Some examples would be fevers, respiratory infections, headaches including migraines, heartburn and GERD, sprains, strains, and joint pain, painful urination, rashes and other skin conditions, cold, canker, and mouth sores, conjunctivitis or pink eye, symptoms of the common cold, flu, and allergies, and constipation or diarrhea. So here are some of the apps that telemedicine providers use. We have Sesame Care, PlushCare, Teladoc Health, Maple, Humana, HealthTap, Amwell, MD Live, Doctor On Demand, and Live Health Online. So telemedicine on your computer. To access telemedicine on your computer, you can use any web browser you prefer. Microsoft Edge, Mozilla Firefox, Google Chrome, or even Safari. Search for or directly type in the web address for the service you would like to use. For example, mdlive.com in Google. So telemedicine on your phone or tablet. To download any of these applications, visit your device application store and search the name of the app you want to download. On an Apple device, you will want to start by opening the App Store. On an Android device, you will want to start by opening the Play Store. So then you will want to access your primary care doctor online. If you like and would prefer to see your primary care doctor, you should ask them if they're set up to handle online or phone appointments. Note, not all doctors are online. If they are online, they might not be on one of the sites we mentioned in this presentation. Virtual visits, Humana. So there's no need to travel, no need to sit in waiting rooms, and no surprise urgent care or emergency room. ER medical bills. Virtual visits may be offered by your current doctor or other providers in your plan's network. When you have an emergency, such as a life-threatening injury, illness, or major trauma, call 911 or go to your nearest ER. Virtual visits are covered under many Humana plans and may cover medical and/or behavioral health issues. Find out if your plan has these benefits. You can click on the link here and it'll take you to the site to find out if you have these plan benefits. Virtual visits. Talking to a doctor is easy, anytime. Can't see a regular doctor in person? Virtual visits make it easy to access care from a board-certified doctor via a secure video or phone appointment from your home or on the go. Doctors may even be able to prescribe medication. Humana is a Medicare Advantage, HMO, PPO, and PFSS organization and a standalone prescription drug plan with a Medicare contract. Check with your plan for specifics on your benefit coverage and what medical necessity rules apply. Virtual visits, available to help with a wide variety of non-emergency conditions. Medical doctors are ready to help 24 hours a day, 7 days a week, and behavioral health specialists are available by appointment. Conditions may include allergies, sore throat, cold and flu, diarrhea, insect bites, depression, and anxiety. Why register? You'll have access to a variety of member services, including the ability to print your member ID card, edit and update your personal and payment information, add an additional policy to your current coverage, search for provider, quickly reference your benefits and payment details, get answers to frequently asked questions. About My Humana. Once you've registered, you can choose how you want to receive information from Humana, online or in print, view your coverage and benefit details, check the status of your claims, find in-network doctors, hospitals, pharmacies, and urgent care centers, update your contact information. Eligible members may use My Health to access their personal health information, screening, labs, and more. And if you click on the Learn More about the benefits of registration link, it'll take you to the website. Teladoc and Aetna. With Teladoc, you can talk to a doctor by a phone or video 24/7. So if you can't make an in-person visit or want to avoid the ER, you have convenient support to take care of you. To confirm telemedicine coverage, just log into your Aetna member website. If you are a Medicaid member or if you are covered by one of our partners, Banner, Aetna Stutter Health, Aetna Texas Health, Aetna Innovation Health, or Alina Health Aetna, please refer to your specific plan benefits. You can also call the number on your ID card. Ways to get support. Call your doctor to see if they're participating in telemedicine or if they think you should visit the office for any chronic health needs. Since they already know your medical history, they're a great first option. Even if your plan doesn't offer telemedicine coverage, you may be covered for a virtual visit with your doctor. Aetna Health. Manage your benefits right from your phone. The Aetna Health app puts you in charge of your healthcare and benefits. With just a few taps, you can find a doctor and see what procedures may cost. Talk to a doctor by phone or video in just minutes. Pay your claims and compare costs before you get care. Pull up your ID card whenever you need it. See benefits and coverage details specific to your plan. Track spending and progress towards meeting your deductible. View, filter, and pay claims for your whole family. Find in-network providers near you and search by the location or specialty. Compare cost estimates for doctor visits and procedures. Receive personalized recommendations to help improve your health. Access telemedicine through My New Clinic. routine care for common injuries and illnesses, and chronic care for established patients. Medical insurance required, available from 9 a.m. to 5 p.m., and it's available in 34 states. Sesame Care. Sesame Care and their team of American doctors/specialists are reviewed as very trustworthy, offering a variety of services and assistance. Appointments are easy to schedule, but a virtual model is provided to help the process be quicker and more convenient for one to use. So Sesame Care offers a number of treatments for medical issues. Some include skin care, mental health, chronic condition care, wellness and disease prevention. You can book a same-day appointment for an initial health visit, considered to be the most affordable telemedicine company. Maple. Maple is a Canadian telemedicine provider, accessible through their app and website with short wait times and variety of convenient features. Their features include quick consultations. A meeting with a doctor can be started within 2 minutes or less. Online prescriptions from doctors. They can be shipped to your address or to your preferred pharmacy. Maple specialists are available on demand within 24 hours or by appointment, depending on the specialty. Specialties include diabetes counseling, diet and nutrition. If Maple cannot help you, you will not be charged. Side note, Maple is not covered by provincial health plans. Payment for services is required. MD Live. Fast, hassle-free American healthcare with 24 hours on-call doctors, licensed therapists. Register for free now or sign in if you already have an account to be able to speak to a doctor in minutes and get a prescription sent to a pharmacy near you when needed. Cares for allergies, cold and flu, COVID-19, addictions, anxiety, cold sore, hives, rosacea, pink eye, rash, and more. So here's how to book an appointment with MD Live. Starting out with MD Live, first of all, you're going to go to this link out here, which is www.mdlivenext.com. You're going to click on the Get Started button. Once you click on that, it should take you to this page where it says, let's get started. It will ask you for a bunch of information, such as your first name, your last name, your current email, and then you'll have to create your username and a password. Once you've done all of that, it'll take you to this page, which will ask for your date of birth, your phone number, your zip code, your gender, and then it will ask you if you do you receive MD Live as a benefit through an employer, insurance provider, or organization? And then you'll just have to agree with the terms and privacy policy. So once you're in, you'll have to get started by setting an appointment with MD Live. So once you create an account, you're now able to see a doctor. These costs will vary based on insurance coverage. So for medical visits for providers available for 24/7 hours by secure video or phone for adults is $82 per visit. It will tell you what this medical visit does for. So for the $82, you will have it. You can use it for allergies, cold, cough, flu exposure and symptoms, sore throat, minor injuries, pink eye, sinus infections, skin infections, UTI, and more. So you'll have to click see first available, and right under it is schedule a visit. So that'll help you schedule a visit. If you want a therapist, you will have to pay $108 per session. The therapist you can use it for addictions, anxiety, bipolar disorder, depression, grief and loss, and more. For a psychiatrist, your assessment and medication management, you'll have to pay $284 for your first visit. Your follow-ups will cost $108 or less. And this you can use it for, again, anxiety, bipolar disorder, depression, panic disorders, trauma and PTSD, and more. And for a dermatologist reviews your symptoms and replies with a treatment plan within 72 hours. Per visit, it's going to cost you $95. You can use it for acne, rosacea, skin irritation or infection, suspicious moles, hair loss, dandruff, nail concerns, and more. You can select the services you like by clicking on Schedule a Visit. Setting the reason for your visit. You will then be asked to describe the reason for your visit and your symptoms by clicking on all the ones that apply. So a chatbot will ask you what is your reason for seeking care today, and then you'll click on whatever your reason is. So if you have allergies, you'll click on allergy. If you have COVID-19, you'll click on that. It'll give you a bunch of options, and if none of your options are here, you can click on something else and it will show you more options, or you will be able to type in your options. The system will continue to ask you more specific questions as you select. It will take a couple of minutes. You may be asked to provide a photo. This is not required, but if the issue you are seeing a doctor for is visible, example, a skin rash or pink eye, it can be helpful for them to have this beforehand. Fill out your health profile. Just like at an in-person doctor's visit, you will be asked to provide some health information. So I'll ask you a bunch of questions and you'll just have to answer them yes or no. Select your doctor and appointment time. Now that you've filled out all your info, you can select your appointment. You have the option to choose the doctor's language, specialty, and gender. You can also choose a phone or video appointment. Payment and insurance. Once you have scheduled your first appointment, you will need to fill out payment and insurance information. Your cost will be recalculated based on your coverage. Additionally, after you have gone through this process once, your information will be stored in the system. You are now scheduled. Now that you have scheduled your appointment, you will be directed by the site as to how you will contact your doctor. Depending on what you choose, this will either be by phone or video call. Remember, not all apps look the same or offer the same services. Do your research before choosing a site/application you want to use. Use Google to read articles about all different companies and decide which one is best for your needs. These apps are great for minor symptoms and can be a good option if going to the doctor is too difficult, but they may not be appropriate for all your medical needs. If you're interested in learning more about this emerging form of patient care, you can click on this site. I'll leave the link in the chat. And then the other site is the top-rated telemedic apps. I'll be giving you a quick tour of MD Live. To go to MD Live, you're going to have to click on www.mdlive.com, or you can just click on this link. So once there, this is the home page of the website. So it will show you a bunch of options. So on the top right here at the menu bar, there's members option, which tells you how it works, what they treat, behavioral health, dermatology, testimonials. There's the business option, which tells you about health systems, health plans, employers, virtual primary care. Providers gives you some options for the providers they have and how you can become a provider if you're looking for that. There's a bunch of resources here which talk about careers, blog, press room, virtual care resources, and then contact us as about their numbers and emails for how you can contact them. So if you are new to this website and you want to create an account, you can obviously just scroll down here and click on this button where it says create my account right here, this orange button. Or you can just scroll onto the menu bars and right next to sign in, there's a create my account option up there. So once you click on create my account, it should take you to this page, and then you'll just have to fill in your information and it'll help you create your account. But if you already have an account like I do, you're just going to click on the sign in button right down here. For sign in, I'm just going to sign in. So once you sign in, it will ask you for your location. I'm going to change the location to Florida. So once you've changed your location, it will give you the time zone. But yeah, this is the main page, and you can change your location to wherever, so it will provide you with better like options for your doctors. Now we're going to like book our appointment. So once we're in the main page, if you see there's the cyber senior profile right here, I'm going to click on that. And once I click on that, it shows me the options I have to book an appointment. So currently the medical visit option I have $82 per visit. And if I want to like book it or schedule a visit, I'm just going to click on schedule a visit. And it'll just ask me a bunch of questions. So what is my primary condition / symptoms that I'd like to discuss with my doctor? Do I have allergies? Do I have red eye? Do I have sinus and cold symptoms? And I'll fill this out, and it'll keep on asking me more questions until the doctor has figured out what my problem is, and then diagnose me, and then like, you know, giving me medicine for it or prescribing me medicine for him. I'm not going to go through that. I don't have any of those problems right now. So this is like, you will have to make sure to click on your profile that pops up here, because otherwise you won't be able to find your appointments, or you won't be able to find any type of like scheduled doctor visits or anything. If you want to add a dependent, you can click on here, and it will just ask you for a bunch of information for your dependent, and you can add your dependent there. Left side of there's this pop-up bar. And so if you click on the options that is shown here, I'll show you a bunch of things. So if I click on appointments, the very top, it will show me all of my upcoming appointments. So I haven't really scheduled any appointments, so I don't have any. It will show me my requested appointments if I have any, and then it will show me my completed appointments, but I don't have any of those either. So there's nothing here. But if you did have them, they would show you all your upcoming or your requested and your completed appointments here. So messages, if you click on that, you can see all the messages you've received from your doctor or the ones that you've sent to your doctor. Photos and files. This is where photos and files, this is your records, right? Photos and files. Yeah, this is your records. So this was where if you want to show your doctor a photo of like the disease you're suffering. So if you have a rash, you'll click on upload a photo, take a photo of your rash, and then send it to your doctor. You can either upload it from your computer, or you can upload it from your mobile if you're on your phone. Whichever one works better for you, you can just choose it here, and then you can send your doctor a picture of, if you want to send a picture to your doctor showcasing whatever's happening with your body. Your health and profile is basically just your profile and then your health. So it will ask you a bunch of questions if you just want to like do a genuine health checkup. So do you have any allergies? Yes or no, you're going to answer that there. And once you've done answering that, you can enter your body measurements, your current vitals. This is optional, so you can just fill this information out, and then you can just send this to your doctor. If you want to know your behavioral health history, that was just your general health history. If you want to know your behavioral health history, you can like click here, or you can just like check off whatever one you want. And then if you want to explain, you can explain. It will ask you a bunch of more questions of any of the following conditions, like alcohol dependency, anxiety, bipolar disorder, depression. Have you ever been hospitalized for mental health or substance abuse? Has anyone in your family been diagnosed with any of the following? Has any family member ever been hospitalized? Do you have a gender preference for a provider? This could be very important for you or not. So yeah, that's for your behavioral health, for your health profile. Your lifestyle, if you want to have a healthy lifestyle, you can just like check that in here. Do you get 7 hours of sleep daily? Do you exercise? Do you get yearly flu shots? Do you smoke or use tobacco? A bunch of these questions. And then your family history, if you want to add that as well, because some of these are genetic, so asthma, cancer, and a bunch of these questions, and you can add that. And If none of them are here, you can just click on other and then explain. So that's for your family history. So your pharmacy is next. Like I said, some of the times, if your doctor prescribes you a medicine, it will either be delivered to your house, to your door, or it will be delivered to a pharmacy of your choice. So you can click on select pharmacy, and then in your area near you, you should be able to enter in all the information and choose your pharmacy if you want your medicine to be your prescriptions to be dropped off at your pharmacy instead of your door. That's your pharmacy. Labs, lab history would appear here, lab orders and results will appear here. So you can keep a track of all of the lab orders and results you have. So the next is coverage. If you have like a dental coverage program, you will be able to see it here. If you have air insurance, you'll be able to see here. So currently, you can like fill in this information and then submit it, and then it will give you coverage for that. If you need help and support with your account or just in general, like with any of these questions, you can either just like click on these questions and see the answer. So how do I contact MD Live's customer service? You can see that. Or if you just need their general information about their like email or their number, you can just call. So they have their numbers and emails right here on the right side. So that's for help and support. And lastly is your account. So this is just where you would update your profile and the other information you have. So your address, your city, your state, your zip code, and whatever you want, you can edit that. But that's your personal information. And if you like just scroll down on the main page, on like the bottom right side of the website, you can see this number 800-400-6254. If you aren't comfortable with like booking appointments like from here or like through a computer, you can literally just call this number and they will be able to book an appointment from there. So the number is on the bottom on the right hand side of the page. It's for more information, and it's 800-400-6254. Thank you for listening. If you'd like to learn this lesson with a Cyber Seniors mentor, please go to www.cyberseniors.org or call 1-844-217-3057 to register a one-on-one phone or web session. We also host weekly tech drop-in sessions from 2 to 3 p.m.